Hey ladies, it's Kim Bukta coming to you with another video today. In today's video, I want to talk about vaginal estrogen. The reason I want to discuss this is it's been so helpful to me during this perimenopausal transition, and I want to make sure I got this information out to you ladies since it's been such a benefit to me. So vaginal estrogen, first off, comes in many formulations. It comes in tablets, it comes in vaginal cream, it comes in suppositories, and there's an estrogen vaginal ring also. I want you all to know that vaginal estrogen is safe. So this is not a systemic hormone. This is a local hormone, so it's not absorbed systemically. There's been many studies that show no significant systemic absorption. They show no increased risk of breast cancer and no increased risk of endometrial cancer. So again, there's been many studies to show this is very safe for women and that every woman can use this. So again, it's not a systemic hormone. It is a local hormone for vaginal care. So what is it mainly used for? So it's used for vulval vaginal symptoms. What does that mean? It means it's used for vaginal dryness, vaginal itching, burning, pain with sex. It helps restore the epithelium in the vagina. It helps restore your moisture. It brings the pH back down to the normal balance, which restores your normal flora down on the vagina. It is also used for urinary symptoms, so like urinary urgency, urinary frequency, and it also has been shown to reduce the risk of recurrent UTIs. So again, better than prophylactic antibiotics. There has been randomized control studies and there's meta-analyses that show a reduction of 26 to 58% in recurrent UTIs. So again, that's a pretty significant reduction for people that have recurrent UTIs. Why am I telling you all this? Because it really helped me in this transition. So again, when I started on systemic hormone therapy, that did not help with any of my vaginal symptoms. I still had significant dryness. I had itching. I thought I was having recurrent yeast infections all the time, which was not. It was just itching related to this perimenopausal transition. I had the urinary urgency, frequency. I was getting up to go to the bathroom, 3 times a night. I had to get up to go pee. I felt like I had to go all during the day. I would have some bladder leakage. I definitely had dryness during sex, difficulty achieving orgasms. So again, a ton of vaginal symptoms that my systemic hormone therapy was not helping with. So I talked to my provider about vaginal estrogen, and with starting this has been a huge help. So I feel like my symptoms have gone away. Things feel normal down there. I am not getting up to go to the bathroom at all at night. So I sleep through the night now and I don't get up to pee at all, which is lovely. During the day, I don't have that urgency. I don't have leakage anymore. There's much more lubrication during sex, and my orgasms, you can achieve them, are back to normal, which is great. So I feel like all these symptoms with doing the vaginal estrogen has been a huge help. It takes about 6 to 8 weeks to, build the effect and accumulate to get to this normal state. So you have to kind of build that back up. So again, there's kind of that building period. But again, it's been super beneficial. Even with the systemic therapy, I had to get on this localized vaginal estrogen therapy, which has been very helpful. So this is not something you can get over the counter. You do have to get it by prescription. So if your providers are not willing to do it, it may be that you have to research one of these online medical sites. Again, I use MIDI Health, but I know like Alloy Health, and there's other medical sites that are willing to write these prescriptions. Vaginal estrogen cream that I use is generic, so it's only $30 a month, which is nice. And another bonus is my MIDI Health provider told me I could use this on my face for a vaginal estrogen cream instead of buying the expensive estrogen creams that are like $100. So I'm using my vaginal estrogen on my face. I just use a little on under my eyes and on my forehead. Again, they say you can use it on your neck or your hands. There's not a lot of studies out there to show that if you use it on large areas that it wouldn't be absorbed systemically. So I'm a little bit more cautious on wanting to use it over my whole face and over my neck and my hands. Your neck's kind of a large area, so I'm just using it as kind of like an under eye cream. Again, you would want to talk with your provider who's writing your vaginal estrogen to make sure that they would be okay with this. But again, it's something that I just wanted you all to be aware of, that my provider did say that was okay. And there are a lot of people out there saying that you can do this. So again, this is just, my opinion. It's not medical advice, but I just wanted to share this information because this has been something that has been very helpful to me during this menopausal transition. When would you want to start vaginal estrogen? I'd say, obviously if you're having symptoms, but otherwise you could consider starting it in your mid 50s or so, just kind of as a prophylactic to make sure that vaginal tissue stays healthy, because most studies show that it's about 10 years after hitting menopause that people start to have these genitourinary symptoms. And again, this is something you can stay on for life. So again, I wanted everyone to know about this information because it's been very helpful to me. If you like these videos, please hit like, subscribe, share them with your friends just so that we can get this information out to other ladies so that we all can learn together and not have to suffer through this time. I'll try to make another video next week. I hope these are helpful. Thanks, ladies. Have a good day.